good.
So, but that was many years ago. But now, because I turned 66, you're not on disability once you turn 66 in 8 months. So now I'm just on retirement insurance, but that's okay. There's nothing they can do for me anyways.
Alright, so I think I might sit
And if you
down.
could just be really gentle, that's why you're the best, okay? Because
I will do my
and
best.
I know I have this really huge bunion. I've had since I've been in probably my like 30s.
Yeah, we're not gonna fix that.
Yeah, I'm not gonna. I know.
Okay.
But thank you for. Yeah. And then you always put lotion on. You put something on that really. Yeah. Oh, but that kind of hurts. But it's okay.
Well, these are super long, so it's gonna hurt a little. I'm gonna go
I
as
know
gently as I
the
can.
long. I know. And is 12 weeks about the right amount of time? for me to
Probably.
come in?
I mean, if this has been a full year,
Yeah, and
then I think you would do fine at 12 weeks.
okay.
Yeah, you've got a tough road.
It's really hard. One of my friends came over to visit me and she said, "Oh gosh, you don't look so good." She said to me, "You look really weak," which I am. But there's nothing I can do. You know, I have a twin sister, and I'm really close to her, so that's nice to have that support.
Does she have the same
She does.
genetic disease?
You know, it's interesting. I had my mother's mother's mother, so that would be my great grandmother, who actually was actually from an area called Ehlers-Danlos, which is, I believe, near Romania or in Romania. She actually died of a. She picked up something heavy, and her insides fell out, and that's actually what happens. You know, like you don't have the connective tissue holding up your body, so
Right.
it could be my great grandmother. It's from.
So that everybody probably thought that was just a family legend.
So no, I don't think people did, because I never really told people about it, but I have a cousin who knows a lot of history of our family,
Mhm.
and she's the one who said what happened to the grandmother, to my great grandmother. So, but I don't really talk about it to people.
No, but I mean within the family, to hear a story like that,
Like, she picked up
she
something.
picked up something heavy and her
And
organs fell out.
Right.
That
And then she passed
probably,
away.
yeah.
It sounds a little like,
Sounds far-fetched, but
Yes.
with what you're dealing with, you know.
so I have to be really careful. And I do pick up something heavy. It's very painful.
Okay.
I know. Have you seen nails worse than this?
Oh, gosh, yes.
Oh my gosh, you're kidding.
Let's go. Good? Yep. Okay. No, I don't see anything here that looks fungal.
I'm glad to hear that.
And even if it were, what would we do about it?
Nothing?
Right.
Is that generally, these fungus is hard to get rid of anyways?
They can be, but with your health issues, I wouldn't put you on medication for it.
Of course. It just feels so much better when now my toes are against my socks and my
Yes,
shoes
instead
are,
of your nails.
and oh, it would not be that painful feeling.
Yeah.
I'm so excited about this. I like this. It's just going to feel so much better. Do people ever tell you that?
Oh, yeah. Oh, yeah. You know, and that's one of the reasons that I chose this profession, was that people generally feel better walking out of here than they did walking in.
Exactly. And I think you're the best podiatrist I've seen.
Oh,
and that's
thank
the
you.
truth. I've seen it.
And just so you know, I did not pay her to say that.
Because we do have where I live, there's a podiatrist that comes, but I said, I see somebody really who's good and I don't want to see anybody else, so.
Well, thank you.
That now, it's really funny looking, that one there, that second one, I mean the one that you just cut.
Yeah. That would be the second. We call it the second.
And you called this one the first, yes, that you're cutting.
The big toe. Yeah, it actually has a Latin name that it is called the hallux.
Oh, and the hallux.
Yeah, so we, in
The word
medicine, we
hallux
refer...
valgus. Is there something called a
Hallux valgus, that's a bunion.
Oh, that's a bunion.
Mm-hmm.
And that's where the bunions usually are, right, in that
Mhm.
big toe.
Yep.
Which I have. But it's amazing, it doesn't bother me so much, and I've had it since I've been in my late 30s.
You know, some of the most
Isn't that
severe
weird?
bunions we see are not painful
Isn't that weird?
anymore. They maybe were when they started out.
Yes. And maybe they're a little painful if they rub against my shoes. But
So I'm just gonna use an emery board on your nails because they're not super thick.
Okay, and then you wash my feet.
Yep. Yep, and I wipe everything down and put
Is
some
there brand
lotion.
shoes that you recommend?
No, not really. I mean, you get what you pay for with shoes. So if you go to Kohl's and you buy a $40 pair of sneakers, they're gonna wear out pretty quickly. So there are some stores that have really good selections.
So I have Skechers. Are those good ones?
Skechers,
Yes.
I look at them and say they're more fashion than function.
Okay.
Do you want me to go a little bit shorter on that one?
Do you think that would be a good idea? If you
Yeah,
could
I don't think it'll hurt.
Okay.
So Skechers, I mean, they're comfortable, and if you don't work on your feet and you're not on your feet 10 hours a day,
Right.
they're probably fine. And you weigh like a minute, so they would probably be nice and comfortable on your feet. But for people who want to use them for exercise and stuff like that, I usually say
I can't
no.
really exercise much. So
Yeah.
after that. But is there a brand or a store that you recommend to go? And in
Well-
the old days, you could go somewhere and somebody try them for you. You know, they put them on you.
Mhm.
You don't have that anymore except
Well,
the Chewlers.
Right, and that would be the place I recommend. And all of their shoes are quality, and you get what you pay for though. So you're not gonna walk out of
It's
there.
more expensive.
Yeah. You know, a good pair of shoes is gonna run you $140, $150.
They've really gone up. Wow.
Yeah. But they have athletic shoes, but they also have a lot of other really nice shoes. When I first moved here in the 90s, they were pretty much the old lady shoe store.
Yes.
But they really have adapted, and they have really nice shoes. I buy a lot of my shoes there.
And but again, there's not really a brand that you recommend.
Not really, because everybody's foot is different. And so it really is what fits you the best, what's the most comfortable, and what's a good quality.
Good quality, that's important. The good quality is important to you.
Yeah.
But hopefully not too expensive. Can this weather make you cough when it's cold outside?
Absolutely.
Okay.
Absolutely, when it's this cold.
Yeah.
And for everybody watching, it's about a wind chill of -10 right now.
Oh my gosh, I didn't know that. Okay. I know the wind gusts were up to 53 miles an hour. I heard on the news this morning.
Yeah, coming out of the grocery store after work last night, I thought I was gonna get blown over. Alright, so these look like they belong to somebody different now.
Oh, and it just feels so much more comfortable. I can tell they're not going to rub against like the tip of my shoe, and I'm so glad about that.
Right. So what we'll do is, we'll have you schedule your next appointment for about 3 months.
Okay.
And then, if the weather's bad or if you're not doing well or something, just call and cancel,
All right.
and we'll reschedule.
But I'll try to do it in 12 weeks. That would be great.
Yeah.
Thank you. You always do a great job. You should be listed in the best podiatrist. Do they have it?
I made it 1 year.
You did.
I did, right when I first started, before every podiatrist was with a big hospital system.
I remember. I used to go to a podiatrist. He was good, but then they stopped. The hospital systems didn't.
They won't do this care anymore.
And that was many years ago.
Mhm.
I used to go to a place right on Williston. I think it was Williston Avenue, or Williston Street. I forget the word.
Well, thank you for letting us do the video.
Okay.
Hang on, don't jump.
Oh, that's
You're up
right.
in the air. All right.
Oh, so you heard all my talking. I